My name is Divyansh Agarwal. I'm a third year surgery resident at MGH, and I'm excited to be here. I'm sorry I couldn't be there in person, but it's honestly been humbling listening to all the talks this morning. And I think, in some ways, this scoping review on surgery sort of amalgamates a lot of the lessons that others have already shared, and you'll, hear a lot of similar themes come up. I'm presenting this on behalf of all of my colleagues who were instrumental in making this possible, especially Dr. Bharani and Dr. Aki, who are also surgical residents and put in tremendous efforts in making this possible, as well as all of our mentors at Brigham, as well as the University of Adelaide. We have no conflicts of interest to disclose. So our scoping review really sought to address three big questions, which is how has climate change affected three aspects of surgery over the past decade? And those aspects were surgical disease burden, the care delivery, as well as peri and post-operative surgical outcomes. And in the next few minutes, I'll talk about some of the big picture lessons we've learned in each of these domains, as well as highlight the key themes that came up during our literature review. So this is the console diagram for our workflow, wherein we looked at three databases, Embase, PubMed, and Scopus, and we focused predominantly on articles in English and looked at the last 10 years worth of surgical literature. We attempted to be fairly broad so as to not miss any important studies, and our keywords were also relatively broad in that regard. And this allowed us to screen roughly 2,900 studies. And the good aspect of our workflow, we think, is that each study was vetted by at least three surgeons. And ultimately, we did full text review of about 86 papers and included 26 of these in our scoping review. And in addition, we also came across 4 studies from the gray literature that we also incorporated in this work. And here's a breakdown of those studies. So focusing on surgical disease burden, that's where majority of studies had come up with a correlation between climate change and surgical diseases. And the predominant diseases that came up in our scoping review were kidney disease, soft tissue infections, traumatic injuries, as well as vascular surgical disease, predominantly due to rise in thromboembolic events. The next category where we had the maximum number of studies was surgical care delivery, where 9 studies had established some sort of a correlation between climate change and how delivery of care was impacted. And the two main themes that these studies fell under was either a surge in surgical demand or disruptions in supply chain, predominantly during disasters. And the last category of surgical outcomes only had 5 studies that we could identify over the past decade, which had consistently showed a correlative association between a climate change event and a peri or post-operative outcome. The common ones being surgical site infections, length of stay, as well as complications, again, infectious in nature, but correlated with nutritional deficiencies. And I'll focus on the nutritional deficiency sort of theme in particular because the 4 gray literature studies that we included in our survey also made this correlation between nutritional deficiencies and how that'll impact a surgeon. And this was our way of trying to summarize all this literature, which is that the predominant theme in these studies was that rising CO2 levels would make the staple crops less nutritious. And in turn, this would affect levels of vital nutrients, proteins, as well as zinc and iron deficiency. And this cascade of events would ultimately result in poor collagen formation. It'll change the ratio of collagen 1 to collagen 3, as you all might be familiar, during the wound healing process after any surgical incision, which is natural part of wound healing. But the consequences of that would be poor wound healing and higher rates of surgical site infections, or at the very least, surgical site occurrences, which basically includes uh, events like a seroma formation or superficial cellulitis without any deep tissue infection. So going into the specifics for each of our three main domains, we looked at four main drivers of climate change, which was rising temperatures, rising CO2 levels, as well as natural disasters and changing patterns of precipitation and overall sea levels. And firstly, looking at surgical disease burden, we found that the key themes identified in our 13 studies was increased injuries and traumatic injury burden, as well as for particular diseases, people had reported increased incidence of necrotizing soft tissue infections, as well as increased associated abscesses. There were studies that had made a correlative sort of documentation of how increased temperatures can be associated with appendicitis or with urolithiasis and ultimately even incidence of urosepsis. There was one study that had linked increased temperature to thoracic surgical diseases, most notably pneumothorax, with a slight increase in incidence of aortic dissections as well. For the second domain of surgical care delivery, the studies basically focused on interruptions in care delivery, like I had alluded to. And this was due to a variety of reasons, including infrastructural damage, decreased capacity and resources, especially in low resource settings, as well as relocation of populations, which a couple of papers had alluded to, that made delivery of care that much more challenging. And lastly, in terms of surgical outcomes, it's pretty similar to what I had mentioned, which is that there was an increase in surgical site infections that three studies had shown an association with. And there was one study that had done an interesting modeling approach, trying to associate higher perioperative risk due to increasing pulmonary and just overall cardiorespiratory disease burden, especially in the elderly, which is a theme I know a couple of my colleagues earlier this morning had also touched upon. Then there was one study that had looked at increased post-operative complications, such as increased incidence of arrhythmias as well as kidney disease. And there was one study that came out of India, which had also showed slightly elevated risk of morbidity and mortality in a matched cohort population. Altogether, our existing work had its limitations. The biggest one in our mind was that it did not really look at how conflicts, which unfortunately are becoming increasingly common globally speaking, how those would affect resource scarcity in a scenario where the society is dealing with climate change, and how that will affect distribution of surgical diseases and amplify inequities. There were also studies that basically had tried to come up with a correlation between cyclical patterns of surgical disease without necessarily taking it a step further and correlating it with climate change. For instance, we came across six studies that had looked at cyclical variations in appendicitis as well as diverticulitis, and it found that there was increased incidence of this disease during summer months. But they had only gone insofar as to make a correlative statement with respect to the seasons, but not necessarily taking it a step further to climate change. And lastly, like I mentioned, the overwhelming majority of studies that we found did not really go so far as to use more sophisticated causal inference methods. There were only 2 studies out of 26 that had any kind of sort of time series analysis or that had attempted to balance their cohorts. And that remains a major drawback, at least in the surgical literature. In terms of takeaway messages from this work, certainly, the 26 studies and the 4 papers from the gray literature that we identified make it pretty clear that the most notable, well-documented surgical sort of disease that's affected because of climate change is infectious complications and the rates of SSIs. Over half a dozen studies from virtually every continent had alluded to this. And certainly, increasingly, people are appreciating in surgery that exacerbated cardiopulmonary disease, which can be attributed to climate change effects, will also worsen peri and post-operative complications. And with that, I'll be happy